Clinical documentation must support the code selected. Chronic diseases treated on an ongoing basis may be coded and reported as often as the patient receives treatment and care for the condition. Codes that describe signs and symptoms are acceptable for reporting purposes when the provider has not confirmed a diagnosis. Uncertain word. When describing a confirmed diagnosis, do not apply uncertain words or terms such as probable, suspected, possible, suspicious for, suggestive of, rule out, working diagnosis, consistent with, compatible with, questionable, apparently, likely. In the absence of a confirmed diagnosis, document the signs, symptoms, abnormal test results, or other reasons for the visit. Each visit should stand alone, which means that healthcare providers must support all risk adjustment diagnoses every time documented in the notes. Avoid documentation cloning since conditions documented on previous visits may not be clinically relevant on the current visit. When reporting a recurrent condition that is still valid for the current visit, the healthcare provider should document it in the notes. As a healthcare provider, you are responsible for documenting and supporting all relevant conditions. Radiology and lab test results. When documented alone within a progress note for a date of service, abnormal radiology and laboratory test results are not acceptable for data validation purposes. The treating healthcare provider must indicate in the record the clinical significance of the test result. Addendum. An addendum is used to provide information that was not available at the time of the original entry. Visit note is addended to document new diagnoses resultant from tests ordered during that visit. The addendum should also be timely and bear the current date and reason for adding or clarifying the information being added to the medical record. The physician must provide substantial reasoning for the change within 30 days of the initial documentation. The addendum must be based on an observation of the patient on the date of service and must be signed by the observing physician. Documentation and support. Supporting the documentation is essential for validation of risk adjustment diagnosis by CMS. Medical record should provide support for MRA diagnosis through signs and symptoms documented in review of system and physical exam notes. Medication linked to condition for which it has been prescribed. Results of diagnostic testing along with the clinical significances. As we said before, healthcare providers must avoid conflicts or contradictions with information throughout the medical record. Let's read some examples of conflicting or contradictory documentation.